is Genevieve, and I'm a sophomore public health major at Belmont University. Being a public health major during this time has really helped me to understand so much more of what's going on. I decided to study public health because I wanted to study epidemiology eventually, so that's like disease spread and following trends of diseases. So this semester I'm even taking a health communication course, which focuses a lot on crisis communication, which has been really interesting as like we're watching the news and other news outlets. So with public health, there are always real-world applications because public health is everywhere, but a worldwide pandemic has really added a deeper level to that, which has been so interesting. So I hope that was helpful.
I chose to major in public health because I knew I wanted to help people in my career. However, I didn't really know how I wanted to help people. And public health has been a great fit because it gives me so many options and so many different ways to be able to help people. In terms of COVID-19, I've really enjoyed learning about the social determinants of health, and I feel like this pandemic has really brought to light the different things of social determinants of health, like how someone's socioeconomic status really affects their health, and like how we've seen with millions of people losing their job, that's really going to affect how they receive healthcare, if they can afford to receive healthcare in the future. And I just think that's really interesting and something that this country needs to work on, and something that I'm excited to get to work on and hopefully will change or have a small part in changing for the better in the future.
So really quickly, I'm Deviani. I'm a public health major at Belmont. And as you know, we are currently in the middle of a pandemic, and the interesting thing is that as a public health major, understanding the pandemic has been it's been easier than the average person, and it's really interesting. So as we know, COVID is a communicable infectious disease, and that's actually one of the reasons I chose to be a public health major. And it's interesting to see that as I take classes through the major and learn about how all of this relates to the pandemic.
Hi, my name is Tanner Smalling, and I am a public health major at Belmont, and my favorite class is a class called Current Issues in Public Health, which is where we address the current issues that are facing our public health system and sort of the stuff that is in the news. So, for example, if I had taken the semester, we would have probably spent the entire semester discussing the coronavirus pandemic. So I just found that class to be very, very interesting in regards to the content, because we always just talked about what is going on in our world and our world around us. So it really gave some insight into the modern world. And also what is happening in our field study.
Hi, so my name is Cassidy Townsend. I'm a senior public health major at Belmont University. In the past few months, the world has gone through a huge transformation from the presence of the COVID-19 virus. As I learned in my social determinants of health class, there are disparities in the U.S. healthcare system. These existing disparities have greatly increased the impact of the COVID-19 virus on minorities and other vulnerable communities. From what I have learned in my public health classes, health equity is needed to fight pandemics such as COVID-19, and a great way to create health equity is by informing the public on these disparities.